Now we are going to talk about common pulmonary pathologies. We're going to first look at the difference between restrictive and obstructive pulmonary conditions. So if we remember our normal tidal volumes and the lung capacities, here's the normal scale with our inspiratory reserve volume, our tidal volume, expiratory reserve volume, and our residual volume. So here's our normal. When we compare it to restrictive, all of the lung capacities are going to be much smaller. So everything is going to be compacted into a smaller space. All the reserve volumes and the residual volumes will be here. As far as obstructive disorders go, everything's going to be a little bit larger, especially the residual volume, because you have that trapped air inside those lungs that's causing that obstructive disease. So everything else is going to be a little bit longer, especially that residual volume. So let's start with restrictive disorders. The first one we're going to talk about is atelectasis. This is the partial lung collapse, not a full lung collapse. And patient will present with increased work of breathing and fever. We want to prevent this because it could lead to pneumonia. So as therapists, you can work on deep breathing is probably the first line treatment for atelectasis. The next condition is pneumothorax. So atelectasis is partial lung collapse. Pneumothorax is full lung collapse. Your patient will present with sudden shortness of breath and sharp pain, and we'll treat this with a chest tube with suction. Another pulmonary condition is pulmonary fibrosis. Unfortunately, it is a fatal lung disease, and the life expectancy for patients who have been diagnosed with pulmonary fibrosis is anywhere from 2 to 5 years. So as a therapist, you just want to monitor their vitals and increase their lung volumes, since their lung volumes will have all been decreased. Now we're going to talk about some obstructive pulmonary conditions. Everyone's heard of the poster child for obstructive disorders, and that is COPD, chronic obstructive pulmonary disorder. It is a huge umbrella term to envelope a bunch of diseases, but the two most common ones that you'll hear are chronic bronchitis and emphysema. Even though they are both obstructive disorders, there are some major differences. And the chronic bronchitis is going to be bronchi inflammation, and it's going to have a significant mucus production. The difference between chronic bronchitis and emphysema occurs more distally. The alveolar walls are being destroyed. With both conditions under the COPD umbrella, you're going to have common signs and symptoms such as cough, dyspnea, a flat diaphragm, barrel chest, and a lot of muscle weakness. So it's really important for you to strengthen the accessory muscles and the primary muscles associated with breathing. It's important to do pursed-lipped breathing. Pursed-lipped breathing creates the back pressure that helps open up those alveolar walls that are getting stuck and allows more surface area in there to allow for oxygen to be transported through the membrane, therefore better breathing and oxygen capabilities. Another one is asthma. It is airflow obstruction, and it is reversible. It's when expiration is greater than the inspiration. So patients with this will present with wheezes, shortness of breath, and tightness, and it could be treated with a bronchodilator. Another obstructive disorder is cystic fibrosis. Unfortunately, it is a condition where mucus forms on every organ, not just your lungs, but all your internal structures in there. So the patient's going to be presenting with a cough, a recurrent lung infection, shortness of breath. Patients with cystic fibrosis are perfect candidates for airway clearance technique to help get all of that mucus and secretions up and out of their system.